HRW has released a statement where it's looking at how the government has managed quarantine, and it's calling it quarantine conditions undermine rights. Now, this is from the human rights perspective, and it says ensure access to healthcare, sanitation, and information. And we've discussed this in detail. Let's now talk to somebody who works at the Human Rights Watch, who understands these matters, in deeply and bigly, like we like saying. This is Otsieno Namwaya. Good morning, Otsieno.
Good morning to you. It's actually Otsieno Namwaya, not Otsieno Namwaya. Those are two different people.
Okay. Otsieno Namwaya, thank you very much for joining us. So the statement that was released by HRW yesterday looks at the quarantine facilities and what has happened in these quarantine facilities, the issue of human rights in these quarantine facilities. You look up at how they have been managed and how maybe they have been mismanaged. What exactly is the thrust of this statement?
The thrust of our statement, which we issued jointly with the Kenya Human Rights Commission and Journalists for Justice, is that people are being forced into quarantine whose conditions are not healthy, and in many cases we found that people could have been exposed to infection while in the quarantine facilities or while being transported there. And we found that even those who are later tested positive and were taken into isolation facilities, mostly in hospital wards, were not given adequate care or probably no care at all. And they were left in the ward to struggle with the disease on their own and probably overcome it on their own without any form of medical attention. So trust is that we are asking the government to look at the way the facilities are being managed and the way the whole quarantining policy is being implemented, because before a few days after the quarantining started, the government itself issued some protocol that ought to be followed, either before somebody is admitted or after somebody has been admitted. What the conditions there need to be met, and what kind of assessment needs to be taken or to be done before somebody is admitted. However, this is not, the protocol itself is not being followed, and we found that to be very strange that the government itself can issue protocols that it doesn't follow.
So who's supposed to be enforcing these protocols, Otsieno? Because it's good to hear they're there, but evidently there's a breakdown in terms of their enforcement. And also, is government reporting on these protocols as would be expected or required?
The first question is who is supposed to enforce? I think it is the Ministry of Health and the health officials who either supervise or manage these facilities. So the paradox there is that it is the same Ministry of Health and the Ministry of Health officials who drafted and published the protocol, who are supposed to implement it, but they don't implement it. For example, contrary to the protocol, some facilities were, actually most of the facilities were never cleaned and they were never fumigated, even after somebody from that facility had tested positive.
Mm-hmm.
Then in most of those facilities, the authorities did not implement or enforce the social distancing requirements. In those facilities, again, people are using shared cutlery, which actually the protocol says should not happen, but it was happening. In some of the facilities, people are not given bed linen. Where they were given, for 14 days, they were never washed or replaced. So even if we say there's no COVID, that condition alone of not cleaning or replacing the bed sheets for, say, 14 days is unhealthy. Many other infections can occur. The second part of the question was who reports? I didn't get the second part of the question.
Yes,
Is
if
the
there are
government
protocols, there's a presumption that there's responsibility assigned for the implementation. You're saying it's the Ministry of Health. Ministry of Health is huge. So it would be, I guess, useful to know who is responsible, let's say, at institutional level. And are these people then giving a report back? Or is government issuing a code of, these guidelines and then leave it at that? If I work in an office, we have policies, but for those policies to be implemented, you then give them to this manager. You are the one who is responsible for
enforcement.
For implementing this thing. And every so often, you're going to give me a report with some kind of, So do you get a sense that this is happening, Otsieno?
I think in the protocol itself, they state clearly that each facility, that is each quarantining facility, is supposed to appoint a team leader and a deputy team leader. So the team leaders are supposed to be responsible for the enforcement of the protocols.
I think this is what we saw as not happening, Otsieno, because if we scrutinize this protocol much earlier on, and if it was just on quarantine facilities, we saw that there were certain things that were not actually taking place. And it's interesting because it is government quarantine protocol. That is somebody from the Ministry of Health who put this together. And then there was certain follow-up that needed to happen across centers, and this we're looking across the country. But then it was clear that within a very short time that the protocol essentially was not being followed. Right? There were certain things that were not happening because, like you say, we had people who then were eating all in the same place. Cutlery was not being sanitized, rooms were not being cleaned, water was not being provided, sanitizer was not being provided. And this was across board, whether you want to look at what was a government facility or even private facilities, because then the protocol then had to be followed even in the private facilities, right? So then doesn't it then point to the fact that then the entire protocol then would be seemed to have failed if a particular component of it did not work?
Yes, it virtually failed because it was not just one particular component that did not work. I think many of the components did not work. They were never enforced. Let's take, you mentioned the private facilities. Let's take the private hotels. A number of people, because the presumption was that those who went to private facilities were probably treated better than those who went to government facilities. But we did talk to those people who went to private facilities, and we learned that on the first day that some people went to private facilities like Pride Inn in particular, I'm sorry to mention a particular facility, they found that that facility had not been cleaned. So it was dusty all over. It felt like it had been neglected because the hotels had shut down and sent away staff for like 2 weeks before it started being used as a facility. And the requirement in the protocol was that before people are admitted, the facility needs to have been cleaned, fumigated, and most of the places sanitized, and the sanitizers provided for people who are arriving, and masks. Most of the facilities never provided masks. And those who did provided them like days into the quarantine. The ministry itself was supposed to do testing. According to the protocol, they were supposed to do testing the 5th day, which is surprising to me because I thought the testing should have happened the 1st or 2nd day. However, that never happened. Most of the testing happened on the 8th day. And then, yes.
So basically, there was a failure of processes and also failure of follow-up. Let's continue this conversation after we take a short break, take a look at weather, and then the conversation continues. You're speaking with Otsieno Namwaya. He is a senior researcher with Human Rights Watch. we are looking at the state of affairs at the quarantine facilities from the very beginning up to present. We'll also now come to present, what's happening in the quarantine centers. Now we know that quarantine is not only in Nairobi, it's actually now gone to the counties as well. Who's managing that? Say the same protocols being applied that were being applied earlier. And also, I think we'll also look at the isolation centers. Before we went into this break, Otsieno, we were talking about the management of the quarantine facilities. And we had asked who's in charge of a quarantine center. So we started from the very basics. And you're saying, according to the protocol, the people who are taken to quarantine should elect their own leadership, come up with their own sort of team leader. But then who does this team leader report to? Who does he liaise with? Who do they liaise with? Is it a public health official? Is it a medical doctor? Is it the head of that institution? Maybe the headmaster or the hotel manager?
Yeah, and Otsieno, just adding on to that, where is this process breaking down? Because obviously protocols are issued, and I think from the ministry level, their expectation, and from the task force level, their intention is that these protocols be followed. But obviously it's breaking down somewhere. So to assist the process, again, stating that, the guidelines, the protocols aren't being adhered to is nothing new, because this has been said before. So I think what would help is to understand, so where is it breaking down? And obviously it's up to the ministry to make sure they are enforced, but as a organization that's gone in and studied, what are the pointed things you identified as the breakdown of the protocols, and what recommendations are you making? And to whom are you making them, so that we see a change? Because people's lives are being impacted here. And yes, it's good for us to show solidarity and to plead their case, but also we want action. So where is it breaking down? And to whom are you directing this plea for action?
Well, that is the puzzle, because most of the people in the facilities who are saying that for quite some time after being taken in, they didn't know who to consult or who to go to whenever they wanted something or whenever they had a complaint. In many of the facilities, people started wondering on the third day that they had not been tested and wanted to be tested to know their status, because they were interacting freely and they didn't know who the other person is they're interacting with. And for like 5 days, they didn't know who they could call, who they could reach out to. So the first breakdown that we found was at the reporting stage, there was no clarity on who you can reach out to when there is an issue in the facility. And then after that, I think we didn't quite understand how the ministry was operating. Within the ministry itself, it looked like everything started and ended with the minister. It wasn't clear what other staff in the ministry were doing and what their roles were in the enforcement. So for people...
Did you get to interview the government official side? Is there resistance, or is it a sense of lack of support? Is it sabotage? Is it incompetence? Did you get a sense of what the problem could be?
We did talk to frontline doctors, some of the doctors who are in charge of certain facilities. And what we found was a sense of frustration on their part as well. But we did reach out to the minister, Honorable Kagwe, and we reached out to him through various channels. One via his own phone, via his WhatsApp, and also an official letter to the ministry, to him copied him via his personal email, and there was just no appetite for the ministry to respond. They never responded to us. And after we released our findings, we did share with the Honorable Kagwe directly on his WhatsApp and on his email, and his only response was that what we had published was utter rubbish, because they don't even have flights, but the report is not actually just about flights, but about the management of the facility. So there's a bit of arrogance on the part of the ministry, and some kind of don't care attitude. I think people are saying that even when they get an official to whom they can complain, either they were dismissed or there was some sort of threat used against them.
I think we saw a situation actually where people were honestly trying to come to terms with what was really going on. Such a thing has not happened in this country, and maybe points to certain irregularities that we see, COVID or not. And I think also this particular ministry then was brought to having to do some work finally, and to get some things done. But are we seeing something that could now shed light on how things should be done, and should be done even more when we want to now go to other sectors, of society? Because like I keep saying, COVID is going to come, and after some time, we're not going to have quarantine centers or isolation centers anymore. That will become a thing of the past. However, we do have other areas where people's rights, protocol is not followed for certain things to be done. Is it not an opportunity for an audit to be done and say, look, this is the way we should be doing things at the very least?
It would be an opportunity if the government was willing to listen. But if you begin to encounter that kind of arrogance where people are not even listening, and we were telling them very basic things like, look, the facility should have been prepared even before you send people there, and they don't want to listen to that. I think we could only say this is a missed opportunity. Probably there are lessons to be learned, but we don't know whether the leadership has learned anything. If we were confronted with a similar situation, say 5 years from now, I don't think that will be any different. Consider that some of the very basic things that are done.
We're really struggling to hear you.
Let's try and get you on a different line, Otsieno. As we take a short break, take a look at traffic, try and get you on a clearer line, because this one is, I think we're basically just losing you as we go on. Otsieno Namwaya is a senior researcher with Human Rights Watch. They released a statement yesterday looking at what the status is in quarantine facilities from a human rights perspective. We are taking a short break at 28 minutes to 10 o'clock. Take a look at traffic and then come back with this conversation. And we'd like you to join in the conversation as well. 0719-012-600. What is it that we ought to now start pushing for so that there is better management of the quarantine and isolation centers countrywide? And it's the same thing that Human Rights Watch is saying. There was a clear something was not working. And at some point, when Jiro asked you, Otsieno, who exactly are you? Who's responsible for this, and who is the Human Rights Watch asking to take action?
Like I mentioned, that everything looked like it was starting and ending with the minister.
Yes.
But if you're talking about government and who should take action, it will appear that the buck stops with the president. Because there was supposed to be coordination between the Ministry of Finance, because it looked like some of the things were not happening because there was no money. Like in Kiti, in Nakuru, people didn't have bedding, and they didn't have water to drink or beds. Mm-hmm. And when they asked for water, they were told there's no money. Money has not been released. Mm-hmm. So it looked like the Ministry of Finance needed to be working closely with the Ministry of Health, but it looked like there was no coordination within government itself. Also, it looked like the Ministry of Interior, which was providing security, needed to understand what measures were required within the facilities, like the quarantining. But the police there looked like they didn't know that they are dealing with a contagious disease, and they needed to be more cautious and to help people to avoid infection. But the police were acting like they didn't know.
Yeah.
So there was lack of coordination between the ministries responsible, which to me would suggest that there was lack of coordination at the very top of the government, and also the Ministry of Health, which was the one in charge, basically the one coordinating efforts. I think either they didn't know what to do, or they were impaired because of lack of leadership.
Yeah, well, these issues come out in our earlier conversations about the difficulty of coordination within government in this response. And I think it's coming out again in a very practical term. And what I'm also trying to process, Otsieno, is the fact that the minister was rebuffed your report and your findings. Because if I was sitting in a position where I've issued protocols and I'm getting a report that shows things aren't working, I'd be keen to find out why they're not working as opposed to rubbishing them. Yeah, and I do agree. It comes back to leadership. What's your next action? Because this sounds like in 2 months' time, maybe when we are closing quarantine centers, or in 2 months' time we'll be at maybe the peak of infection. So there'll still be in 2 months' time we can expect to have the same report. So what's your next course of action, Otsieno?
We know the report we issued 3 organizations, Kenya Human Rights Commission and Journalists for Justice. And our thinking is that probably we need to have a sit down with the government first before we consider other possibilities. But it is also something that is being discussed internally, whether it is possible to also facilitate some of the people who are basically violated in the facilities. And there are some who actually believe, and they credibly so believe, that they were infected within the facilities, and that was because of the carelessness of the managers of those facilities. What ought to be done is probably to facilitate them to be able to seek legal redress. But that is way after we have had discussions with the government to see what is being done to address. There's one sad story, by the way, which I need to tell, of a security officer of a facility that I will not name, because then I'll be disclosing his identity, who didn't know that there were guests coming in, and those guests were from many, many other countries. They had come from the airport. And he didn't know. He was just at the gate. And then everybody else in the facility took off, left the security officer to check in these guests, check their details, show them rooms. When he finished, he was told, now, you can't go home because you have interacted with those people. You have to be quarantined. And after he was taken in for quarantine, he had not been told. He tested positive. And after he tested positive, he couldn't pay the amount of money that was required at the end of when he finally recovered. And he was detained in that facility for an additional 6 days. So it is basically a violation after violation from stage one
left,
after
right,
the
and
end,
center.
if you look at the whole of it. And such people, if you look at it, those such people require some legal redress of sorts.
Maybe we could also point you to, because we spoke to somebody who was a security officer at Lenana School, who faced a similar kind of detriment. They were working at Lenana School. Lenana School was converted into a quarantine facility. He tested positive, and then there's a whole contact tracing of who he had come into contact with. After going through the isolation, he was still being told he ought to pay. And, these are the issues that were coming out of that whole process. And I think among the pressure that, was coming out from such people is what led the government to realize we are basically also creating stigma with this COVID by even telling people that they ought to pay for everything around COVID. And I think one of the reasons why now we are seeing the government saying we shall foot the bill of quarantine and of isolation and treatment for COVID.
And if I can jump in. Sorry. No, go ahead, Otsieno.
You wanted to say something about stigma.
I wanted to comment on two. I wanted to comment on two things: the stigma and the government's pledge eventually that will pay. On the stigma, I think a lot of the stigma came from health employees, Ministry of Health employees. The only people who didn't seem to be stigmatizing those who are either in quarantine or those who are in isolation were doctors. But a lot of the health facilities, the staff there either had not been sensitized or they were just scared. They were treating those in quarantine or in isolation as though they did not deserve to be alive. So in one case, which basically illustrates what was happening in most facilities, the staff would refuse to talk to the person in the isolation center, and yet they were supposed to provide food. And when they came with food, they dropped the food outside the door on the floor. Yet people had been told they should make sure they don't touch the floor or the wall because it could be infected. But they will drop the food on the floor, on the corridor, along the corridor where people are passing. And they would not tell the person that the food is outside, come and pick it. After they drop the food on the floor, they'll run away.
Yeah.
And the person will not know for a very long time, like an hour or two later when they open the door, they discover food has been lying there for like an hour or two and it's cold. They had been told not to eat cold food, mostly eat warm food.
Yeah.
But here it is a situation where food is regularly dropped at the door and people run away. There's nobody you can consult. When they call for food to be warmed up, people refuse to come because maybe the person has already touched the plate. So a lot of people that we talked to say that they were traumatized by this kind of treatment. When they came out, they were again treated by the same way because once you're picked up, your neighbors know that you are picked up because you're possibly exposed.
Yeah.
Now, the problem with the community is that they don't know the difference between quarantine and isolation. So when you're quarantined,
You automatically
because
have
you're
COVID,
suspected,
right?
you may test positive or
Yeah.
negative.
Yeah.
But when you test positive, then you go into isolation.
Isolation, yes.
However, there are people who are taken into quarantine who never tested positive. When they come out, people don't want to even take their money. They can't buy anything within the locality,
Yeah.
even food. And government has not addressed that issue.
You know, one of the things
Then
that...
let's go to the issue of
Sorry, go on, Otsieno.
the issue of payment. Yeah, on the issue of payment, the government has had pronounced itself and said they will pay. But the reality is that they don't seem to actually understand what the issues are. Because a lot of people, it's a very basic thing. They want to go in, they want to be tested, confirmed to be free, and treated like human beings, and then let go. However, the government, since it announced, it is saying that they are not paying for food. So people are being taken in forcibly, and they're being told, we are not giving you food until you pay 10,000 for food. Those who cannot pay 10,000, they are told, you have to tell your family to begin to bring you food. Now, that undermines the whole idea of quarantining. Because then you're now exposing the whole family who have to regularly come to this facility to bring food.
Have you considered Otsieno, there's a coalition in Parliament of human rights members of Parliament, and unfortunately, the late Ken Okoth was the chair, and a very dynamic chair. But it's quite a vibrant committee because from what you're saying, immediately there's two big gaps that aren't adding up for me. One is health is a county level function. So you would expect that these centers actually have, close level of supervision
by the county
by the
government.
counties.
Yeah.
Why isn't it happening?
Yeah.
Could it be, as Kamodo was saying, that national government has centralized and is setting up isolation centers without the coordination of the counties at the local level? Who are the people?
Who's setting up the isolation centers at county
staff?
level?
Would they not be county staff?
It
And if
should
they are
be.
county staff, they'd be under. So is it the counties that are mismanaging? What's this breakdown? And then the other is, where are the members of parliament? Because every isolation center, every quarantine center is in a constituency. What on earth are they doing? Have they isolated themselves as well? I am just aghast.
They're getting kicked out of committees.
They're doing politics. Oh yes, I forget. Bigger business. This because it's great to say that legal action will be taken, but lives are being impacted right now and people are still earning salaries and they're supposed to be working for the people. This is what we were discussing before about how we're going to raise money to pay those salaries. And these people aren't working for the guys who are affected. So I hope as a strategy, the trio of organizations will consider putting pressure on the institutions, beyond the minister.
Yeah.
Those institutions.
Yeah, that is true. I think whether the county governments were failing, it will be difficult to tell, because it looks like in most county governments, the assumption was that the central government was in charge, and therefore they took either a backseat or just a supportive role. There was a facility that was identified in Busia, where that lady with her child was being admitted. And I think the county government was supposed to be responsible for providing security and medical support, medical personnel. But what surprised us when we checked into that facility was that other than the security guards at the gate of that facility, there was no one else available for people who had been quarantined, whom they can reach out to. Assuming they fall sick, there was no health personnel.
Yeah.
There was nobody from either the kitchen or support staff. It was just the security guard, 2 security guards at the gate itself, and somebody is quarantined there and is alone there the whole night and the whole day, and they have nobody they can revert to. Who do we blame for that? Is it county government or is it the national government? I think there's more of responsibility that the national government should assume, because when they identify such a facility that they're going to be taking people there, they also need to be to ensure that the requirements are met, the standards are met. The government wasn't ensuring; they were just declaring this facility is going to be a quarantine center, and they don't follow up. They just throw people in there.
Yeah.
It's emergency response committee. That whole structure, because there's a structure that is responding to COVID-19 that goes all the way to county and village level. And the emergency response committee has Council of Governors representation in the name of Isiolo Governor Mohammed Kuti. And he's also now the one who's helping to coordinate at the county level. But also the task force also has members of counties. It has CECs from counties. It has other organizations. I think the entire, coordination of the COVID-19 response is the one that has those many loopholes. And it starts from that point of the National Emergency Response Committee, chaired by Mutahi Kagwe. It has all the other coordinating ministries are present. The Ministry of Interior and Coordination of National Government sits in that committee. The PS sits in the task force. All these people, it basically means that even when you're talking about an isolation center or quarantine facility being set up at county level, it's the governor who's in charge, but they are coordinating all the way to the very top with NAC.
So something's not working.
It's
and
not.
City brought this out yesterday. I
and
don't know
he's
whether
on the
his
line.
solution. Yeah, I don't know. I hope he's heard this.
City, you've heard what we are hearing from Otsieno Namwaya in terms of their research around the country and management of quarantine. Basically, the mismanagement that we saw in Nairobi has been devolved.
Actually, it hasn't devolved. It has metamorphosized into a monster.
That's exactly right.
Something bigger.
By the way,
Much bigger.
Yes, Otsieno.
Okay. CT, carry
All
on.
right, we have lost Otsieno. Yeah. City, go ahead.
Yesterday there was a point I was trying to make and I actually didn't make it well. Remember when I talked about merging 2 ministries, the Ministry of Health and the Ministry of Internal Security?
Yeah.
What I was thinking about was this. When you look at the issue of COVID, remember, it's not the disease that is our problem if you think about it. It is the things around it. Like now we're talking about the things around COVID. We're not talking about isolation centers. We are talking about quarantine. When you have a situation where there is now poverty staring at us, you have a situation where unemployment is increasing. You no longer have a health problem, you have a security problem. And if you have a security problem and you're not addressing it before it sort of like gets out of hand, then you will have a situation that is much worse than the situation that Otsieno was explaining. And this time around, why it will be terrible is because, one, most times when we've had a situation where people are going on strike in large numbers or there's a political impasse, we know that ODM is behind it.
And this time,
there's no one to point fingers to now.
It will be a mixture of many individuals whose same problem is that they have an issue, but there is no centralized leadership.
Yeah.
So it becomes very, very difficult to manage. It looks like we're talking about something that is far-fetched. But the truth, what is far-fetched is how the government can actually demonstrate its ineffectiveness when we know very well it has the capacity to do what was required.